Hello, good morning. So, welcome to Aspire
Morning.
Session. Welcome, Dr. Abdul Hakeem.
Oh, thank you. Thank you for letting
Thank you
me
so
given the
much
opportunity.
for doing this session. So, let me introduce all of you. Dr. Abdul Hakeem. He is working in A&E in North Middlesex Hospital in London and is doing it from last couple of months. And today he will be discussing his journey to NHS. So, how he struggled in PLAB or in OET or in IELTS and job hunting. So, he'll be discussing from the beginning till the end all the things that he has faced during this time. So, Dr. Abdul Hakim, so yeah, you can start.
Oh, okay. So, as thank you so much for giving this opportunity. I'm so happy to help you guys. Maybe if my journey, my story, if that's gonna help you, I'm more than happy. So, my being myself, I'm Dr. Abdul Hakim, as Uncle introduced you. I am working in North Middlesex Hospital, University Hospital here in near Tottenham, and I'm working as a trust doctor in emergency department. I joined in first week of March, and I'm doing kind of it's almost 3 to 3.5 months since March. Yeah, it's
Mhm.
going fine and good.
Yeah, that is absolutely okay. So, we want to start from the beginning. So, as everyone knows, like for PLAB, we need to have English competency, and we have got two options, OET and IELTS at the moment. So, we just want to know about your journey, which test you took, and how did it go for you?
Okay, so that's when I talk about the English language test. Uh, that was one of the difficult stages which I had to encounter in this whole journey of the PLAB journey to UK.
Hmm.
So, being from my side, I studied in Kerala, the southern part of India, and I studied in the local language schools until my med school. So, I had significant amount of difficulties when I dealt with IELTS. I started doing IELTS, I think, in by the end of 2018. I
Hmm.
gave 2 attempts. I was kind of okay in the rest of the modules from speakings, listenings, and readings was fine. I got through and I got the minimum required marks that they wanted us to have. But I struggled in writing. I
Hmm.
was always stuck with writing, and I was stuck with 6.5.
Right.
Mm, yeah, so even after 2 attempts, I thought like, oh, okay, let me give one more try. But luckily, by Feb 2019, GMC came up with an advertisement saying that, okay, guys, come on, we have OET. You can come on. We are happy to take you through OET. Oh, that was one of the best moment. I think I felt relieved. I was really happy,
Hmm.
and yeah, I gave a try. I didn't prepare much for the OET. Of course, I
Right.
was working in Delhi that time. It was quite hard. Was
Hmm.
doing 24s and 48s alternate.
Right.
So what I did was I found one of my tutors who gave me online coaching, because he
Hmm.
used to spend 1 hour alternate days when I had off after my 24-hour shift. So
Right.
he spent 1 hour, and I prepared for 20 days, and he told me you're ready to go. I went and gave it. Thank
Right.
God I got it. Yeah, that was one of the difficult part. So once I finished the English exam, I
Hmm.
felt really free and happy, because I knew, even my friends told me, the things which is going to happen regarding the PLAB 1 and PLAB 2, the whole things on all the stuffs that what they're going to ask you is there in your mind, since you spent almost 5.5 to 6 years in your med school. So you don't have to
Right.
worry about
Hmm.
you don't have to worry much about that. Just have to modify things that up and down. And yeah, that's how I did my
Yeah,
English test.
it is really nice. I know, like it was a bit difficult, like for international graduates to pass IELTS and get that score, especially in writing, as you mentioned, like to get 7 in writing
Yeah.
was a bit scary for all of us actually.
Oh my God. I don't
And
want to think about that.
you got lucky that OET was introduced.
Yeah.
mean, all the international graduates now willing or planning to come to the UK for PLAB. So you have got this option. Go for OET. It is comparatively easy. I know few people say that it's expensive, but I would say still go for it. As Dr. Hakeem mentioned that he attempted IELTS twice and he was unsuccessful, but he gave OET, then he was successful. So instead of giving IELTS few times, just go for OET, and there are high chances that you will do it in your first attempt.
Yeah, so it's almost the same, because one attempt of OET, I think it costs almost 12,500 Indian rupees when
It's
I gave it.
IELTS.
IELTS, sorry, IELTS, yeah.
Yeah.
And I gave one more, so it came almost almost 30,000, isn't it?
Right.
So one OET is just two IELTS.
Yeah, that
So
is that.
it's like, yeah, I know my friends personally. I know a lot of my friends gave it 5 times.
Mhm.
Just really waste of money. But what I would say is it's always a personal choice. If you're confident enough, if you think you can just get through easily, if you're happy to go with IELTS, if you have good English skills, don't waste your money, go for IELTS. But if you're someone like me, don't waste your money, go for OET. OET is medicine kind of standard exam. Whatever modules that they give you, there's always medicine in it, including the interactive side, the speaking side. You will be talking to the examiner as you being a doctor, and examiner might be a nurse or a patient or patient relatives. So whatever you speak has medicine inside, so you can handle it, rather than talking about nanotechnology that you do in IELTS. Someone who comes and tell you, please talk about nanotechnology, which I don't absolutely have no idea about it. So I feel that would be better.
Right. Yeah, that is true. Like IELTS roughly costs is like 160 pounds there, and OET I think 310 pounds. So it is
Yeah.
double. But I mean, if you are giving IELTS many times, then it will become the same. I know one of my
Yeah.
friends more than 40 times IELTS, and they told me once OET was introduced, they were very lucky because they were waiting for a couple of years to do PLAB, but they were
Oh.
not able to because of this thing, you know.
Yeah, it's a difficult stage. It's one of the most difficult stage I've ever had in my whole journey.
User is asking same question. I think we have answered. Sir, I wanted to know about OET or IELTS. Which one is easier, IELTS or OET? As Dr. Hakeem said,
Yeah.
it's your personal choice, but what we feel or what he feels, I think OET is a bit easier than IELTS.
Yeah. If you want to taste it, go for IELTS, taste it, come back and go for OET. Good luck, man.
Yeah, you can taste it. Right. Okay, so I mean, after you did your OET, then you had your English competency. Then as you were preparing for PLAB. So PLAB 1, as all of us we know that it is MCQ exam. So just tell us a bit about your journey for PLAB 1. How did you prepare? How much time it took for you?
Yeah. So my story, PLAB 1.
Yeah.
PLAB 1 was, I felt it's kind of difficult, but most of my friends reassured me, telling that it's not a difficult exam, you can pass. And they gave the positive side of PLAB 1, that there is no biochemistry, there is no much of kind of non practical side. So PLAB 1 was mostly asking about the clinical oriented question. So a lot of medicine, a lot of subdivisions of medicines like urology, neurology, and all of that. So all the questions that you encounter in PLAB 1 was most of the things which you see in your daily life, daily practice. So
Right.
it was fine. But I was working in Delhi again, so I didn't have much time to sit back and give a lot of time for studying. So what I did was I studied 3 months for PLAB 1. So
Okay.
I was working 24 hours and 48 hours of alternate shifts. So what I did was I printed. The platform I used. So let me be clear about that. I subscribed plabable.com, the
Mhm.
best platform, the number one platform which I used, plabable.com. And the second one I used was Plabzilla. I had a few PDF forms of that. It's like a book, and they
Okay.
discuss question answers. And the third one I used, just to make sure that everything is covered and just to do a reassessment, I
Mhm.
used 1,700 questions by Dr. Khalid. So these
Okay.
are the 3 platform I used.
Mhm.
What I did was I printed the Plabzilla PDF form. I I carried it with me to my clinical kind of areas. When I work, when I used to get kind of free times in between my practice, I used to go through those questions and just tick it off. So when I come back, when I come back and take rest, and when I have free time, I opened my laptop and I went through the flabbubble.com, which was quite nice. So I went through this kind of study work phase until 2.5 months, and when it was kind of 15 days, the 2 weeks to exam, I took personal leave. I took 2 weeks off from my work, and I gave all the time for flabbubble.com and revisions. I gave mocks. So that's it.
Right. So I mean,
That
yeah,
one.
so that one, as you know, is MCQ. So as such, you don't have to attend classes or something, but yeah, you can have the question bank. So as Dr. Hakeem said, so he used Plabbable. I think most of the people are using Plabbable these days. I think they are most updated and
Quite nice.
guidelines, and they have got a very good app, and they are doing their work really well. He's my friend actually, the Plabbable Dr. Z doctor.
Oh, that's cool.
Yeah, so they are doing
Yeah.
job. And yes, Plabzilla and Dr. Khalid 1700. So that's also like another option that a lot of international medical graduates they are opting for, and they are available online, and they are good because yeah. So Plabable, I think people are not able to download or print the thing. So I think these things you can do.
Plabzilla would be fine. You can print it. Even in 1700, Dr. Khalid's fine. Thank you so much, Plabbable. Thank you so much, Dr. Khalid. And I don't know who prepared Plabzilla. Thank you so much, guys. You made it.
Yeah, right. All these people, I mean, they're doing great job making
Great
it
job.
easy when it comes to Plab One.
Yeah. Even Dr. Khalid responds in Facebook. So he is really nice heart. He's one of the good person that I have met. So one of the best.
Yeah, I have
that I have.
a lot about him also on the Facebook. I have never met him, but yeah, I think all of us we see his post and his comments and everywhere in Facebook.
Yeah.
Great to know.
Nice.
Okay, so Plab One. So you did Plab One. In which month you gave Plab One? I mean,
I gave 2018 November.
November 1. So November happens all over the world actually. So I think you gave in India only.
Yeah, India,
Right.
Delhi.
Right. But now, you know, as they need lots and lots of doctors, actually they are conducting all the 4 exams in all the countries now. Initially, they used to have November only for international centers, but now they have got everything. Like even September and June, they are doing in overseas centers.
That's quite nice. So when I compare the Plab 1 exam with the NEET exam that we had in India for the postgraduates thing, you have to waste your 1 year age, 1 year, which means one age. So if you don't get through one exam, you're 1 year older than the previous year. So you're wasting your ages. So what I would suggest is don't wait. You can always go for NEET, but if you have 2 attempts, 3 attempts, and 4 attempts in 1 year for Plab 1, just get rid of that. Just try to use the opportunity and just go for it if you're planning for UCAT.
Yeah. And all of our users, those are planning to give Plab 1, just one thing, now GMC has opened another date in October as well. So they will be having Plab 1 in September, in October, and in November. So go for it as soon as possible. Book it.
Oh my God. That's
so
cool.
it means, I think, Dr. Hakeem, GMC or NHS needs us.
Yeah. We need a lot of doctors. Yeah, we have to have a lot of doctors. So the work environment that we have here is really nice. So you don't see much patients as to use. Okay, so let's discuss that by the end of the session.
Yeah, let's go one step by step.
It'll be better.
Yeah. So after Plab 1, just tell us a bit about your Plab 2 journey. So as all of us, we know that it's an OSCE exam, so you need to interact with the patient. Those who are acting, actually, they are simulators. So the journey in Plab 2.
Plab 2, that's the stage I became an international person. So the days I applied for visa and I got a visa, I was so happy I'm traveling to UK. So rest, like everyone, I was really happy because that was the first flight that I took from India to UK.
Right.
And yeah, so what I did was applied through GMC. They got permission, I applied for Plab 2, and I was in search of academy. So Plab 2, in general, the exam, most of you must be knowing, is a practical assessment where you have to assess a patient and in a cubicle, you'll have a patient to talk to, and there'll be a third person like an examiner who is watching you, and they'll just give you marks according to your performance. So this is Plateau setup, and you have 18 station like this in Plateau exam. So what I was looking for was a place to train and to get into what they are looking for. So I had different options, and I chose Aspire. Aspire was one of the best place, and it was a bit scary thinking about Plateau performing in front of people, especially when you have patients who are actors. And I heard they all are professional actors. They act really nice, and that's true. I had the worst experience. So what I did was I listed academies and the exam time that I planned, and I kind of um, ran through the academies, the reviews that I got, my friends' suggestions were Aspire. Okay, so I came over, I met you guys, Ankur and team. Was one of the best experience. We felt friendly, we were comfortable all through our course, even during our preparation. And the mocks that you had, Dr. Ali, one of the best. He made the medicine like the real medicine. You just take it, just spoon feed it. So
True.
was one of the basic classes that we had, and the psychiatrist and Dr. Aman Arora's communication skills, which made a difference, the right perspective about Plateau, what they're looking for. I think he mentioned that he was one of the Plateau examiner, so he know what they are looking for. So he gave us the right directions, and we were so happy about that. And I think we had classes for 14 days, and I prepared for rest of 15 to 16 days. So
Right.
that was all about the preparation. Yeah, it was nice.
That
All
is the
slow. I miss you guys in London.
yeah. We were initially in Oslo, London. Now we have shifted to Manchester. That's
I'm
great.
looking forward to join you.
Definitely.
There is a slot for me.
Always a slot for you. No
Cool,
need
cool,
you ask. Just come anytime. We'll be
cool,
more
cool.
than happy. Yeah. So as you said, like so yes, course run for like 12 days. Then we always recommend candidates to have more time, like 4 weeks, 6 weeks, or even 8 weeks. As Dr. Hakeem said, he was having roughly 15 days. So you can go for it. Like you can go for the exam even after 10 days, 15 days. But candidate, those who have got a bit more time, say 4 months, sorry, 4 weeks or 6 weeks, they feel more and more comfortable. But depending on individual circumstances, many candidates, they don't have that much time because of visa and all those issues.
Can I mention something?
Sure.
So it was not just 15 days preparation, okay? So before coming to Aspire, I subscribed Aspire a course. So you guys gave me the online access to the materials.
Right.
So the scripts, I was going through that. I went through 1 month, all the materials except the new cases. But I went through all the modules and topics, and I think 4 of my friends, we used to sit in with Skype, and we used to discuss online as a patient and doctor interaction.
Right.
So I prepared all of the course. So it's not like just 15 days. I'm not brilliant. I'm just an average student. So you all can do it with enough preparation. Give enough time. Whatever time you need, you have to choose, and just give enough time. Don't just rush through it. Okay. I spent 1 to 1.5 months just going through the scripts. And when I attended the class in Aspire, I was already kind of confident knowing the scenarios. So it's not just 15 days. Sorry to apologize for just telling you that 15 days. No.
So I mean that's really good. Before you come for the things like these courses and also, it's always better to do your homework as he did. Like reading through the things, through the maybe guidelines or reading through the notes. And then when you come for the course, you will feel much better, and it will be very like piece of cake for you. And then yes, as he said, he was preparing before he attended the course. That is what is required. So always, like we say, after the course, maybe like 6 weeks or 4 weeks you should have. So as Dr. Hakeem, he spent like 1 month before and 15 to 20 days after the course. So that was really great. So how was your experience in GMC, like with the patients and all?
Yeah. Okay. So when I explain about the patient interaction, I want to start right from Aspire, the preparation that I had. Okay, so as PLAB2 is a patient-doctor interaction, you you have people teaching you things in academy. They like you guys did. They'll explain you scenarios. They'll explain you how to go forward with. But it's always an act. You have to talk. You have to sit with the patient. You have to react with the emotions of the patient. You have to answer the questions. You sometimes have to reassure them without even touching them. So it's quite difficult. What I suggest is that you get opportunities in the class, even while preparation, like you guys gave us short breaks, scenarios. So just take it, go forward it. Of course, you're not going to do well, but for guys who are going to prepare for PLAB 2, who just done PLAB 1 and waiting for PLAB 2, waiting for some academies, whichever academy you go, if you get an opportunity, just take it. Don't wait for until you go for mocks. Build the confidence. What they're looking for is real scenarios. It's not just scripts. They don't want you to vomit what you learn from the academies or whatever. So what they need is real scenarios, genuine talkings, genuine doctors. So if try to be yourself, take opportunities and use all the opportunities that you get. Even the academy during preparation, mocks. Just take it a bit serious. Just go for it. You'll fail definitely, but then the end, the outcome what we want you to get through. So in PLAB 2 GMC exam day, quite nervous, totally blank, knowing nothing. It's like just going and attending. You'll feel like, okay, that's fine. Just go and attend it. So just stay before the exam in Manchester. Just went there. I walked into the GMC building, waiting for the PLAB 2 to start. They're doing the checking our IDs, doing the pre-course assessment. So they'll take you to the academy inside. I think there is a video by GMC. They just take you in lines, in queue, and they'll take you to a clinical area. So a clinical area, which means the exam place, the exam center. So you will enter into hospital, basically. It's from outside, it's a building. But when you walk into PLAB 2 exam center, the exam place, the venue, it's a clinical area. They have a nursing station at the center, and they have different rooms like we have in our hospital. So outside the room, there will be a question written on the wall, and you have 1 minute to read, to go through the question. So there's a bell ringing. That's a time for you to read. There's a bell ringing again, the second bell, and the inside. So you walk inside, you see two people sitting, mostly two people. So what are they? One patient, one examiner. Examiner, absolutely mute. He's not going to talk to you. He's not interested to talk to you. So your concern is someone who is sitting in front of you as a patient or as a relative, or sometimes a mannequin who is talking to you. So what is an absolutely scary thing. But of course, you people guided us right way. I was so happy. I was not worried when I saw the mannequin, the sim man, what we call for the man to speaking mannequin. So what I did was like the communication skills that I learned from Dr. Arora and the training that you gave. Just sit there, be yourself, talk to the patient. You have 8 minutes to go through. You can just talk to the patient and just be structured, stick to the points, what they're looking for. They're looking for data gathering, communication, and the management. So just stick with what they're looking for. Just try to take time from your patient. Always be kind of responsive. Try to build a two-way conversation between your patient and you. Just don't be someone who is talking. Don't be a radio man. Like me, what I'm doing now. Just let Anku also involve in between. That would create a two-way communication. And the one who is listening as an examiner, he's not looking at you, just listening to you. So if he's listening to two people talking an interactive session, that would be that's what they're looking for.
Right. What like two-way conversation, and make sure you are involving your patient as much as you can. That is what is required in PLAB 2. And that is why, that is why they have changed the PLAB 2 pattern. Initially, it used to be something like different. In 2016, they changed the pattern. They included more of counseling and ethics, because when we come from different countries, we are okay with the medical knowledge, but maybe we are not that much good in ethical part or in communication part. So that is why they have introduced more and more of these things in the recent PLAB 2. So that was
Yeah.
a great journey. Uh,
One more thing.
yeah,
Yeah, as all of you know, we have 18 station. You just have to pass 12 out of 18, isn't it?
actually,
11, oh, 11. So
yeah.
you have the right to fail in 7 stations. Take it. Just because you didn't do well in one station, don't just kind of get panicked. Just
Hmm.
don't feel a kind of I'm not gonna pass. Just take it. That's your 7 station. You feel free to fail in 7 station, and just if you take that into it, you don't have to worry to go forward. Just take it, and you'll be fine.
Yeah, yeah. Many people say like you have to pass 11 station, but as you mentioned, we can look at a different way. We can fail. We can afford to fail 7 station,
Yeah,
right?
go for it. That's for you.
Yeah. So
I
it's like,
kept it for you to fail. Take
yeah,
the opportunity.
it didn't go
Just
well.
pass 11.
Yeah.
But I thought I passed 14 because my mentality was the same. Like I was like, okay, so if I fail 1, 2 station, no problem. But I
Hmm.
failed almost more than that.
Yeah.
So don't worry. You're going to make mistakes, especially the first few stations. Or a lot of worries and nervousness. And seeing an actors, real good actors, they're really good. I started the morning session. They were fresh and I was fresh. So I had a
Right.
patient where I had to break the bad news. So it's like someone who diagnosed with cancer and they don't know. So
Hmm.
they did the blood test, I think, last week, and they have come now to see the blood results. So I was the one who is going to tell them that they have diagnosed with the cancer. So I went through the step-away approach that you guys taught me,
Hmm.
but the difficult step I faced was the white man. He became red and he started crying. So I was like, come on, this is an act. No, he is not. He's not just. He is giving us the real scenario. So don't think it's the actors. So they're not going to act much. They are going to give you a tough time. Be
Hmm.
prepared. So give the opposite, the right emotion that what they're looking for. Be
Hmm.
humble, and throw some random good words, and give this the time to kind of take that pain inside. Give
Hmm.
some mute time. So all of that these guys will train you well and better.
Yeah, many candidates they come, and when we teach these things, the Breaking Bad news and other things, they get surprised sometimes. Like, seriously, we need to do these things. Seriously, they're gonna cry. Man, when you go
Oh,
there, you will know that what they do. The actors, they are damn good actors. They are
they're
really, really.
damn good. They're professional. I think I'm looking forward to see a few of them in coming films or kind of series. They're really good.
True.
Really good.
Yeah.
Damn true.
So all the guys, those who are listening to us, you can ask your questions and we'll be answering in the end. So we have got few, but you can keep on just writing and we will be able to answer in the end, not to worry about it. Okay, so after PLAB 2, so now you have done your OET, PLAB 2. So then real thing comes, how to get the registration. So for
Okay.
you, how long it took to get GMC registration for all the
Mhm.
documents and all these things?
Mhm. Okay. So this I thought while after Clap 2, the exam season is over. You don't have to be worried. But then there's always a lot of pressure in each and every stages that we have. So after Clap 2, it's getting registered. So for
Mhm.
registration, you have to have your degree, which you gained from your home country, to be validated by an international body. So who is doing it? Is done by ECFMG. So usually people what they do is between flap 1 and flap 2 they get it done, but I was not confident about my flap 2. I was always worried, so I kept delaying it. So don't delay it. So go to whoever trains you flap 2. They're going to train you well. Be confident and do it. I took quite a lot of some time to get it validated, so 1 month went for that. But actually you don't have to wait for 1 month. Get it validated even between flap 1 and flap 2. So, and what I did after that, you need to have your medical degree validated. I have it. The second thing is you have to have the good standing certificate from the medical councils that you worked under. I worked in Kerala, I worked in Karnataka, and I worked in Delhi in 3 years. So I had to take good standing certificate from three different medical councils, and I sent it by postals as well as online to GMC. Yeah, it took 1 month again to get it registered, and yeah, that's it. That's it for the
Yeah.
registration.
Yeah, I mean, now they have simplified the thing by introducing this ECFMG. Actually, when I did, ECFMG wasn't there. So it used to take a bit longer. So now you have got this ECFMG. And as Dr. Hakeem said, you can do it while you're doing PLAB 1 and PLAB 2, or while you're waiting for your result of PLAB 2. So you have got around a month time. So you can utilize that time at ECFMG. So you won't be spending a month maybe after you have passed, because that time you just need to have your registration and you just want to start as soon as possible.
True, yeah.
Right. So what we need ECFMG, as you mentioned, and good standing certificate from your country in which, area you were working. So you will get that, and you need to get that the fresh one, because it's valid only for 3 months. So once you pass, you can just get it from your medical council. That won't be taking much time. So that's our GMC registration procedure. Because somebody was asking about GMC registration procedure, I think got their answer.
Cool.
Right. Yeah, they have made it straight away now, Dr. Hakeem. Initially, it was not that easy, and I did my exam like a couple of years back.
Oh.
Right. So after registration, now the hot topic comes: jobs. A lot of people like no jobs available. We attempted for these many jobs, these many interviews. So what's your journey like? How many jobs did you apply for? How many interviews you got? How many interviews you got selected? You got rejected? So just tell us a bit.
Okay. Yeah, true. So, just to tell you about the current situation, maybe because of the COVID, there might be some struggle. Of course, there is. We have that in not just with us, in all the areas in UK and across the globe. So there might be some delays, but of course we need more and more doctors to work in UK. Then GMC needs a lot of doctors, especially through immigrants. That's one of the best ways I can get from to GMC. So from my story being genuine, I started applying soon after I got registration. So I applied for more than 350 jobs.
Okay.
For 2 months, I was just applying, no response. Then I started getting responses. I think I got more than 200 rejections. I was not shortlisted. You are not shortlisted. Unfortunately, you are not shortlisted. This was the mails that I was getting continuously. I was a bit scared. What's the reason? Because I have done my IELTS. I have done PLAB 1, PLAB 2. Come on, I have the registration. I'm happy to join you, but I was not shortlisted. I felt a bit kind of low. I asked my friends, so they all told those people who are working in UK already. They told me it's quite normal to have rejections. It is. So, but it's a hard time. I had hard time too. Everyone is going to have it. Don't assume yourself as a super doctor, applying for one job and getting through. No, you are going to face quite a lot of rejections. I faced more than 200 and 250 rejections. I got only 4 chances, 4 positive response, 4. And I had 4 interviews attended. Out of 4 interviews, 2 was declined. I was not shortlisted again. So again, 2 rejections. Fortunately, thank God, I was selected for 2. Then I just went through and I declined 1. Didn't be the both. So I was like, no, I'm not happy to join you. I'm going for another one. So that's my time to take it. So when you have the ball in your hand and when the pitch is kind of dry, go for it. Go for the wicket. So I declined 1 and I got the right one because I want to work in London because of my personal perspectives. So that's it. I got through. So it took almost 3 to 4 months to get one job. Just to get one positive response, it took 2.5 to 3 months. So just sit back and relax. I think because of the COVID, it's taking quite more because they are not concentrating on the job side.
Yeah.
This country is doing a lot of other things. So you have to, the more opportunities are going to come up. So don't be depressed. Don't feel low. You are going to come in. Don't worry.
Yeah, that is true. Like because of COVID, the things are delaying a bit. They need doctors, that is true. And even we know, like after Brexit, they need more and more doctors.
More
That is
doctors, yeah, Brexit, happy for us.
true.
Be
But
happy, man.
yeah, and the thing is, that's true. Like, never give up. It's not like you apply for one and you're going to get that one. So keep applying daily, just on NHS portal. Even you can apply on the trust portals as well. Sometimes some jobs they don't advertise on NHS portal. You might get like a simple what do you say, trust portal as well. So keep applying, keep applying. You will get rejections, but fortunately you will get selected also. So as he said, he applied for more than 350 and rejected in more than 200, and then 4 interviews, 2 selection, and then he got the chance to reject one finally.
Yeah, take it.
Yeah, and once you're working in the system, things will be easy for you. Now if you want to switch off like to another job, it won't be difficult for you because you are in
It's
this.
not difficult, I heard so. I didn't try yet, but then I think so.
Yeah, and also like whenever they start the training, like for example, now they are going to start from August, so there will be lots and lots of vacancy in non-training posts, because all the international medical graduate, they usually start from non-training posts in the beginning. So like those are applying at the moment, August, as trainee will be joining, hospitals will be empty, the non-training post. So there are high chances that you will be getting the jobs. But again, don't get disheartened. It may take time, but the response will come. Just don't give up.
Yeah, yeah. Wait for it.
Yeah, definitely. Okay, so that was your job, and now you're working in A&E and one of the reputed like hospital in London. Of course, London is the dream for most of
Yeah,
it.
London. Yeah, it
Then
is the
they
best place.
aware what is England, they know what is London.
Yeah.
Maybe because of movies or whatever. Like I want to work in London, London. So yeah,
London.
of course, it has got its own charm, I would say.
Yeah.
Definitely.
Even if you didn't get in London, just go for a job, get the NHS experience, and if you want to move to London, then you can always apply for another job.
Yeah, definitely. And
Whichever,
also, Mhm.
go for it. Sorry.
Yeah, as we say, like if you want to start alone, that is true. But the lot of things are not suitable if you are staying in London in the beginning. One is like it's expensive. London is one of the most expensive city. So if you are coming here with the family and you are the only earner, so it might be difficult to survive in London as well in the beginning. So maybe countryside areas are better. But yeah, if you are single and you think, okay, let's start with London, then of course
If you're
London.
single, and if you feel like you're going to be lonely if you go outside, London is the best. A lot of other things. There's a personal perspective. Yeah.
Yeah, definitely. It is your personal perspective. If you want to start from a city or from a like countryside area, that is your personal choice, of
But
course.
by the end of the job hunt, you'll be like, come on, give me some area. I'm happy to work even in the middle of the ocean. So just
True.
take it. Whichever opportunity you get, come over. Just you can just walk in. And if you want to change, if you want to move to one place to another place, there's always a possibility. There's always a chance for you. So
Yeah,
don't worry about the places you're going
right,
to get in.
definitely. Okay, so as we all know now, you're working in A&E. So
Yeah.
you always wanted to work in the A&E, or you got the job in the A&E? That's why you started in A&E.
Uh, I'm not looking forward to grow in A&E. No, I
Mhm,
want to change. My growth is not going to be in A&E,
mhm,
but I'm happy to work because I was working in A&E in my home country. I worked in
mhm,
almost 2.5 years in A&E.
mhm,
So for me to get a job in UK, there is more chances to get into A&E because I have the relevant experience with me.
mhm,
I applied for ENTs. I applied for many other jobs,
mhm.
but unfortunately, what I got was A&E.
Right.
So even I got interviews from geriatric medicines, I got from psychiatry,
Mhm,
but there's always better chances for you to get into an area where you have experience
mhm.
in.
Yeah, definitely. As you were working in the A&E, so definitely the interview that you have given and you showed that I have experience in A&E, so definitely they'll be preferring you in that particular field. That
Yeah.
is so. As you're working in the A&E now, so how's your experience? I mean, working in the NHS, working in the A&E in London. So how's your experience last couple of months?
All right. Okay. It's just 3 months. Of course, there is a positive side as well as a negative side.
Mhm,
The positive side, it's quite different. It's quite good. It is mm, free, and you always have your voice. You have someone to discuss with, so
Hmm.
you have enough the required time. And back home, you work like 24 hours. I worked for 24 hours. I worked 48 hours at a stretch sometimes. So, but this country, they don't push you to work more than 8 hours of 9 hours a day. That's one positive side. You have your time, you have your life,
Hmm.
not just your work. The one side. The other side, you see a patient, you have always your guys, your seniors, your consultant to discuss with. So you can always, your voice is valid. Basically, you are presenting something and they are listening to you.
Hmm.
Sometimes back home, you don't have a voice. You just note down things, you just write down cases, you just order investigations, but then there is no much involvement by you as a doctor. But here, you have things what you do is really valued and people are looking at you. So that's
Hmm.
one side. And a lot of positive side. If you're planning to do some studies, like if you want to do an ALS course, which is an ACLS in other side, so British Council has an ALS. So if you're planning to go for that, your trust would support you. Your trust would give you the fees and things like that. They'll give you study leaves. So it's kind of flexible for you to grow in the system.
Hmm.
But if I want to talk about the negative side, I'm not a negative person to talk much about that, but I want to highlight a few points. It is not going to be easy. It's a different system. It's a different people, different way of interaction, different way of treating a patient, right from the history until you send a patient home.
Hmm.
So if you see a patient, you have a lot of barriers, even sometimes language barriers, sometimes um, people with learning disability. You have to deal in a different way as usually you do with the normal patients,
Hmm.
and the people with vulnerable age, old age people, and you have to deal in a different way. And if you're sending a patient home, you
Hmm.
have to be sure that they are going to reach home safely and comfortably. So you might have to book transport as well sometimes. So it's quite difficult and different. But of course, you have the time to learn. Keep some time, sit back. Even I'm learning. I am learning every day. Every day of my work is something new. I'm learning. I'm going forward. So it's but difficult learning things and interacting with colleagues. They always have a structured way of approach. So
Hmm.
when you summarize a patient history to one of your colleagues, you have to summarize in a structured manner. You go with the situation of the patient, you assess the background of the patient, and you go with your clinical assessment values, and you have to present the recommendation that you are thinking of about this patient. So you have to learn all that, and adapting to this work is quite difficult. But of course, give some time, you will be fine.
Right, right, right. Yeah, that is true. In our country, sometimes we are working, as you mentioned, 24 hours, 48 hours. See, I mean, practically it's not possible. We have to
It's
work
not
from
possible. Yeah,
our mind. I mean, I don't think so.
taking slow.
Yeah, is going to slow down and it is not good for our patients. So that is a good thing here. You will not be working for like say 8 hours or maximum, I think 12 hours. You should not be working. That is
Yeah,
what the
yeah,
guidelines is. And this is what they think, like our mind will not be working in the best interest of our patients. So
that's true.
it's definitely a good thing they are having. And that's also the good point you brought up that hey, it doesn't matter you are a junior doctor, a consultant, so your voice will be heard. What you
Yeah,
want for the patient, what you have thought for the patient, which investigation, and what's the reason behind it, what's the rationale that you have got in your mind. They will listen to you. Like in our country, sometimes it's like what consultant has said that is full and final. You can't even argue with them. But here, your voice will be heard. Your voice will be listened by them, and it's a really nice thing actually.
yeah, it is nice. Yeah,
Yeah. And of course, adaptation to the system is a bit tricky because here lots of things are computerized, and
yeah,
so yeah, it might take a few months in the beginning to adapt yourself in that system. But once you get adapted, you will feel much comfortable, and it will be very easy for you. And I would say, like once you are adapted to this system, you might not be able to go back to your country and work in the old system.
yeah. Yeah, of course. Once you switch from one to another, you have a lot of things to change,
Yeah.
adapt. Usually.
And while you're working, like, how's the interaction with the consultant? Do you find them they are helpful? Like, if you need any help, any leave, for example, or you said ALS, ACLS course, or any teaching, are they helpful?
Regarding the senior support, it's really nice and they're really supportive. I'm so happy to work with my team. They're
Mhm.
always there beside and around you to support you. So if you want to discuss a patient with consultant,
Mhm.
even if you're not structured, even if you're not giving the right information, they're always going to ask you questions. They're going to ask you like a friend. So
Mhm.
you will feel better when you discuss with consultants. And this ALS side, I have always already have mentioned about the ALS dates. If you're planning to do an ALS, if you inform one of your clinical supervisors, there's always someone to guide you along. That's your clinical supervisor, one of the consultant,
Mhm.
mostly, and they'll support you by providing you study leave. And if you get sick, sometimes it's usual. Sometimes you go sick, you may not be able to work, so you can just give a call saying that I'm sick, I won't be able to attend, and they will be happy to give you
Right.
enough rest,
Mhm.
get back to the normal work.
And at the moment, as you know, COVID is there, so hats off to all of you, like working in A&E. So it's not that easy. I mean,
Yeah,
frontline at the
yeah.
moment.
But at the moment, we don't have any COVID. It was quite difficult. It was quite tough and rough days we had,
True.
and we lost a lot of lives. We're so sad for those lives. We lost a lot of lives in
Yeah.
lakhs and lakhs and across the globe.
Mhm.
Hopefully, we would be able to fight against, especially back home, India, Brazil. They all are fighting against this virus. Stay kind of safe. Don't go outside. Do all the precautions that the medical professionals and the frontliners gives you. Just
Mhm.
follow all that orders and the suggestions. Please stay safe.
Yeah, that is definitely like important. Your life is important. So things are improving here in the UK, but things are not well actually in few countries, including as he mentioned in India. Like things are going on the low side. But yeah, so the orders that the guidelines, the doctors, the people are giving. So that is going to be helpful. Okay, that is really nice.
All right.
Yeah, that was really nice. So we have got few questions. Aspire doing the job. Could you please post video regarding neurosurgery or internal neuroradiology? The way do you guys offer PLAB, MRCP? Prepare? Thank you. I think we have to arrange another session for them for neurosurgery and all.
Destiny for sure.
Especially we have got, I guess.
Yeah.
And we have got another one. Is it difficult to get the training job? Or what is the requirement to get the training job? Example, internal medicine.
Okay. So are you going to answer that?
Yeah, we can
You want
answer.
me?
Yes, so I'll answer a few things, then you can add up few things.
Yeah. Go.
So, yeah.
That would be better.
So see, the thing is, my friend, it's not difficult actually these days to get into the training post. So yes, you are mentioning for internal medicine, you can definitely get it. And the requirement, simply like what we would say, being an international medical graduates, just start working in the UK, any of the hospital in the department, I would say, and get your FY2 competency signed by your consultant in the first few months. He will be more than happy to sign it. So just be with him, and he will sign your competency, and that's it. You can just apply for it. There is nothing much that you need for training, core training in internal medicine. So just start working. Don't wait that I will be just joining NHS only for the training course. Don't do that. Just work, because once you are in the system, you will be preferred over others, those who are not working in the system. Just get a non-training post and sign your FYP competency, and you're good to go. Yeah, Dr. Hakeem.
Yeah. True. So
Hmm.
always take a non-training job.
Hmm.
Learn the system. It's different. It's completely different. What you have in your country. Take the non-training job. Come over here and learn the system. Learn the way of dealing with the colleagues, consultants, the patients, and the shifts, and get your competency signed as Dr. Gu mentioned. That will be better rather than going for a training job because
Hmm.
in training job you have your training, so you have to train yourself to learn the medicine. So even before going for training, learn the other sides, like managing the websites. We usually record clinical scenarios and the clinical histories into the system. We have to feed it as soon as you see the patient, and you have to order X-rays, blood tests, and everything online. You have a system. So learning that takes some time. So if that would be always better to learn all these before you start a training job. So it would be really difficult if you're trying to jump into a training job and
Mhm.
learning the websites and the systems along with the medicine. That would be quite difficult. If I'm not telling it's impossible, but then the best way to go for it is go for a non-training job, learn things, and then apply for the training side.
True. Yeah, that is absolutely right. If you start with new training, you will be having a bit of experience of the system, how the things are working, and then it will be very easy, and you will enjoy more when you are in the training, and you won't be feeling like pressure on your head. You'll be more
Yeah.
with ease. You will be able to go in your training. Right. Anyone else? Let's see. So, Dr. Hakim, what do you think? What's your plan for future training?
Okay. So okay. So when I came over here, I had a different plan. I was
Mm,
planning to go for medicine. I had a plan for psychiatry. Even I have a plan for psychiatry even now.
mm,
But things would change as you come in, as you work in this country. You
mhm,
would see other colleagues who are working in the right departments which you want to get into, especially medicines and surgeons will be around. So when you interact with them, when you see them working, then you have time to give a second thought. Am I going to spend rest of my time doing that, or do I need to rethink about something else?
mm.
So I am for myself. I was planning for medicine. I gave up doing medicine. No, that's not the place I want to be. I had a plan for psychiatry. I am still interested to do psychiatry. Of course, I have a plan for GP. I
Mhm.
am looking forward to join GP as well. So these are my plans.
Yeah, I think you should keep your options open. I mean, don't
Yeah,
come with like one mind. Okay, I want to do surgery only. I want to do medicine only. So of course you can have your plans in your mind. Start working and see is you are looking for your future in this field. Can you do this for the rest of your life, or you feel the other things are better? Like as he said, he was initially thinking for medicine. Now he's more keen for psychiatry or maybe for the GP.
yeah,
Right, right. Because other things like medicine, surgery training can take a bit longer. Maybe like
sure.
here in it will take around 8 years, isn't it?
Yes,
But
yeah.
on the other hand, if
I'm,
you go to 3 years,
I'm
and
already old. I can't afford to waste a lot of years.
true, true. Yeah. All the things that you have to keep in your mind accordingly, like maybe your family. So you need to see, like, you have to give time to your family because in other, like in medicine, surgery training, you have to have lots of night duties and jobs. So you have to see lots of other things before deciding. Don't come up with the like fixed mind. I want to do this only. I would say keep your options open. That would be much better.
Right advice. That's the right advice. Yeah.
Yeah, right, right, right. It was really helpful, Dr. Abdul Hakim. Thank you so much for your time. To be very honest, like it was very like straightforward, and you did it in a very simplified way, starting from English exam and then PLAB and then job hunting and your experience in the NHS. It was quite straightforward. So really, really great, and thank you so very much.
Oh, you don't have to thank me. I should be thanking to you guys. Right from the Plab 2, and even after Plab 2, you kept asking me how was the job, how are you doing. Even Dr. Azad,
Hmm.
one of the sweet guy, he is really supportive. He was happy to help me with the
Right.
clinical areas and things like that. And Dr. Amar Arora, he was always there, like someone who is kind of giving you a hand and uh, teaching you the steps to take forward, kind of you're teaching a kid. So
Yeah.
I'm so happy with your team, and thanks for giving this opportunity, giving me a call again, and to give us an interaction. And more than that, if any of you guys are getting kind of inspired or getting some positive points from our side, I think that's the main reason for doing all this.
True.
And if you get something out of it, I am so happy and I'm more than happy. Like Aspire team, like Aman Arora, anyone, everyone. If you have any queries, you can always ask them and ask me. I am so happy to help you.
Yeah. Thank you so much. And let's last, I think, one or two questions also. Let's read them and then we will be able to finish the session. I'm planning to do my MD medicine from India and during the course appear in MRCP. Okay. What are the chances of getting into sub-speciality in the UK after that? The person is asking after doing MD medicine. So in my opinion, I would say like instead of doing the post-graduation in India and then coming here, you can come now and enter into their training system, the UK training system. That would be better, I think, because if you spend 3 years or more than that in India and then come here, things will be changing here, and the training system here is a bit different as well. What do you say, Dr. Hakeem?
Yeah, I have the right, the same kind of piece of advice. If you are planning to train you in India, of course, you have a place here. When you're training in India, you're doing MD medicine. Try to do MRCP exams. Try to give it. So if you're planning to give MD medicine, you're almost giving the same exams, the same books, and the same details that you study is going to come in MRCP exam. So give MRCP exams. Royal College exam is the only exam which is valid in this country. So if you're trained in India, if you have an MD degree which is valid in India, which is that's not going to be kind of valid in this country. That's not going to take it. So they're just going to have a look at your 3 years of training in India, which that would take it as an experience rather than taking it as a degree. You're still a medical graduate, like a junior doctor with 3 to 4 years of experience in medicine. That's the concern. That's the value that you have, even if you have an MD degree, which is valid in India. So if you have an MRCP degree with you along with an MD, that's nice. That's nice and good. You can come over. You can work as a higher post, but I think always better to come in as a junior doctor or even before you do an MD degree and start your trainings here. And of course, then there is nothing else to stand in between you and the GMC.
Yeah,
The
that is,
training.
yeah, as you said, like it will be only counted as your experience when you come here in the UK. So, I mean, you have to decide, and if you want to come, come now. I mean, when you are a junior doctor. How
Yeah.
difficult is to get a non-training post in the UK nowadays? I'm registered with the GC since April 20. No offer so far. So I think I would say the same thing, and I think you agree with me. Keep applying, and things are getting delayed actually because of this pandemic, COVID, that all of us in all the countries we are facing. So things sometimes get slowed down, but not to worry. There are plenty of jobs available. Just keep trying. Never look back. Just keep trying.
Yeah. Yeah. Just believe in yourself. Keep applying for jobs. Keep applying. Even if you're getting rejections, if you're not getting anything, that's okay. Just keep doing what you do. As Paulo Coelho said in Alchemist, that's one of the word I always keep with me. If you want something, if you really want something, the whole world would conspire to help you achieving it. So
Right.
just sit back and do whatever you want to. The whole world is going to help you.
True. I
Like
mean,
in my case, Aspire, Amarora, Plab One, English test, all are going to help you. Just
mhm.
keep applying, you'll be fine.
Right. Absolutely. I think that's it. There is person is route to US after being consultant in the UK. My friend, I think for the US you have got only one option, USMLE.
I don't know. That's not the place I want to be.
Yeah, so we are anything if you want to ask for lab related thing, OET related jobs in the UK and all these things will be more than happy to answer. I think that's it. These are the things. And if you see the question, it will be available on the Facebook and also on the YouTube channel later. So just have a look at it and you will be getting all the answers, I guess. Whatever questions you have got in your mind, you will get all the answers. And if you have got any doubt, you can ask question in the thread and we'll be more than happy to answer even after the session. No problem at all. Okay,
Yes,
so Dr. Hakeem, thank you so much. It was really wonderful. I enjoyed it, and it's almost 1 hour we are just talking, and I didn't feel like it's been 1 hour to be honest.
you're welcome. You're welcome. Thank you so much for the opportunity.
Yeah. Okay, then See you again, maybe once you enter the GP training or any training, maybe psychiatry training, whatever you want, and see you again maybe in a couple of months' time.
Yeah, I want to get into Aspire. Maybe I want to train people. Yeah.
Maybe get the job the training somewhere in the Manchester. Then you have to come once in a week for sure to
Yeah,
meet us.
sure, definitely. Yeah, you're the boss. If you're letting me, if you're kicking me out, I'm okay.
Yeah, thank you so much. Thank you so much. It
All
was
right,
really,
it was really nice. Hey,
yeah.
if anyone if anybody is still in doubt, if anyone wants more advices, more helps, more suggestions, we are always here. We are happy to help you. Just drop some messages into Facebook or somewhere.
Yeah.
Let's see. Hmm.
Thank
Cool.
you. Thank you so much, guys. Thanks a lot.
Thanks so much for watching. Have a
Yeah,
good day. Bye bye.
bye.